It's the Eagle Community Television Forum with your host, Gary Shorman.
Hi everyone, this is a forum program on Eagle Community Television. It's brought to you by HaysMed. We're going to be talking about HaysMed in just a moment, but thanks for watching the program. Our guest today is Jessica Seib, and Jessica is part of the, the baby delivery unit over at HaysMed, and she's an RN there and also head of staff development. So Jessica, tell me a little bit about what do you do every day when you go to work?
Well, I am in charge of the education for our nurses at the hospital. If any new processes come through, any new equipment, things like that, helping the nurses know what to do. If we encounter any problems or challenges at any time, I'm in charge of educating them and helping figure out what will work best and get things accomplished. Then I also still work one night shift a week on OB or NICU during the week.
When you talk about that, let's talk about both those terms. First off, the OB unit and NICU unit. Tell me about both those.
Well, in OB we have 5 labor rooms, and we care for women in labor when they come in to have their babies. And then we have a postpartum care area, which consists of about 12 rooms postpartum. We also care for women who've had hysterectomies, mastectomies there. And then the women who come in questioning whether they're in labor or not, and trying to figure out what needs to go on with them and talk to the doctors and sometimes we do end up flying patients out to a higher level care facility if they're too early to have their baby and they're stable. Occasionally we'll transfer on to Wesley, usually is where we send our patients.
I had a chance to take a tour not too long ago, the OB unit, and some updates there. Just make it a really nice facility, a little different than maybe what it was a few years ago. But families and dads and everybody is involved with the process.
Yeah, we went through a big upgrade change. We now have 2 C-section rooms where we just had one before, and 5 labor rooms up from 1. We had 4 labor rooms previously, and then triage rooms for patients. We had just 1, and now we're capable of 3 triage rooms as well. So it was a good upgrade, and it looks better.
It does look nice. It makes you almost feel like you're at home, because that's one of the things I know a lot of moms are anxious, and dads even more anxious sometimes when you're going through that process, and having a nice facility makes a difference. What is the difference? Because I know you have 4 OBs that are part of the system at HaysMed. What is the difference between that and maybe some other hospitals as far as having OBs involved with the birthing process?
Well, our obstetricians, obviously care for their patients through their prenatal period and then deliver them there at our hospital, giving specific care to OB, obstetrics and gynecological situations, and take care of everyone. Sometimes, there's a high-risk situation that comes up. Occasionally, we will get patients from outlying hospitals that come to us. We deliver babies 34 weeks and over at our hospital. Sometimes we deliver earlier ones and then stabilize the infant and then transfer the infant on. But if we can get a mom and baby transferred together, that's the better picture as far as keeping them together if they are going to deliver early.
Well, the NICU unit also has advanced care for babies that are delivered early, because they go through some challenges if they're delivered early.
Right.
What are some of those challenges, and how do you handle those?
Well, occasionally we'll have a mom that may have come in with preterm labor or her water breaks, and we have to admit a baby into the NICU. If it's anywhere between that 34 and 36 week range, a baby will be monitored in our NICU for at least 24 hours. If they're needing oxygen requirements, antibiotics for any type of infection possible, things like that, we can care for them in our NICU there. And if it's early, or if we encounter more problems after delivery and they're just not stabilizing well, after 24 hours we will ship them on to Wesley Medical Center usually, or Children's Mercy.
Well, that's one of those challenges, of making sure you have the right care, because with delivery you just really don't know what's going to happen along the line that way. One of the things, you've had a couple of designations. Tell me about, firstly, the High Five program that you're working on right now. What's that about?
Well, actually, we in April of this year, we were designated a High Five Mom and Baby Hospital by the Kansas High Five Coalition. And it was a process that started about a year and a half ago in July of 2012, there was core measure information that came out for hospitals to encourage breastfeeding in the hospitals. And so in the process of trying to educate our staff about that, we came across the people who were setting up the High Five program in Kansas, and it implements 5 practices to help moms breastfeed their babies, start breastfeeding and then breastfeed longer duration time because of all the health benefits for breastfeeding. So we had to educate staff, do some education with physicians, change some practices and processes, change our policy a little bit, and then just continue to work on it. We had a few assessments that we did periodically until we got our designation. So
Has that been effective? Have you seen that been helpful with new moms?
yeah, we were just looking at numbers the other day, and we have probably between 85 and 90% of patients that attempt to breastfeed when they have their baby in the hospital. Whether they continue breastfeeding or not after they go home is really set up by how their breastfeeding experience goes when they deliver. In the process of doing the breastfeeding education and getting things set up, we had hired a lactation consultant for our hospital to help. And so she sees a majority of patients on the floor that have their babies, and to make sure breastfeeding's getting off to a good start. And then she's also there for follow-up when patients come back in to see their pediatricians if they need to get extra help with feeding to help if baby's not gaining weight as well, or mom's having a lot of pain when feeding her baby, then they go see the lactation consultant and she gives them direction to help with that.
Now, is this something that starts right away? Because I know a lot goes into some of the training for parents going into this, or does it start at the hospital? Or is that something that parents can get involved with and learn about before they ever get to that point?
Really, if they can learn before coming in is the best way. Our hospital does offer birthing classes, and part of their birthing classes is a newborn care class and a breastfeeding class, and we have 2 nurses that teach that, and they've been doing it for a long time, and they do a really good job. And they help parents learn what is normal expectations, I guess would be the right thing, for when they have their baby. Because sometimes people have this big idea that breastfeeding is going to just go great and it's going to be easy, and it's not always the case. And so that helps them to know that, yes, they're probably going to be sleep deprived. They're probably going to have a little bit of pain. Babies will cry a lot. But feeding them regularly every 2 to 3 hours is important, and if they can make it through the first 2 weeks of breastfeeding, they probably will make it long term pretty well.
And what all goes along with High Five? You have some training classes, there are videos. Can you go online and find out more as well?
Well, there's a...
Sounds like a neat program.
It is. There's a website. It's kansashighfive.com, or I think .org, sorry. And they have a lot of information about all the hospitals in Kansas that are participating in it. Hayes Med was the 3rd hospital in the state to receive the recognition, so we're excited about that. But they have the 5 practices would be, the first one is when mom has her baby, to have skin-to-skin contact as soon as she can after birth, if they can get the baby on her chest right away for bonding. That is the best thing. If baby has some complications, then baby can be taken care of first, and then the first time they get to see each other, then be held skin to skin for the first hour or until the first breastfeeding experience happens. And then we also have try not to give any pacifiers until breastfeeding is established.
You give the pacifiers to the fathers,
there
right?
You go.
Over there, yeah.
Yeah.
About ready to pass out from all this.
Yeah, and then keeping the babies in room with their parents 24 hours a day or as much as possible. There is procedures that have to happen, and so we'll take the babies down to the nursery to get those procedures done, but we try to get them back as soon as we can so that if they're hungry, they'll get a feed as soon as they're showing those signs. And then if there's no food or drink other than breast milk would be the other one, which sometimes medically indicated they have to have some milk if they're not gaining weight as much, but we don't jump to that right away. If we just try to encourage parents, help educate them, give them the right tools that they need to help baby just be breastfed and have the breast milk. So, and then our last one is having resources for parents after they leave the hospital. So people in the community, and then like our lactation services that we offer at the hospital too. can help with that.
You're pretty good getting through all 5 of those, because those of you watching, we're going to have a test a little bit later on. But before, there's a couple, one thing, labor and delivery, there's a couple things, and one of the stats that I picked out in some of the reading I did before this is that babies that were delivered early on purpose. I didn't know about this. We're going to come back and find out more. We'll also find out more how you can go to the Hayes Med site and find out about labor and delivery and what goes on there, and maybe some other things that would help you through the process. We'll be back with more after this.
Youthful body, tight tummy, smooth facial lines. Greystone Cosmetic and Reconstructive Surgery is here to help you achieve your goals and give yourself the new look you've always wanted. Greystone offers sophisticated surgical and non-surgical cosmetic procedures. With services now available locally, there's no need to wait any longer. Contact Greystone Cosmetic and Reconstructive Surgery at Hayes Medical Center today or online at greystonecosmetic.hayesmed.com.
It's a beautiful day in our super high-speed internet great customer service neighborhood. Like you, this is where we live. In fact, our company is employee-owned, so it's our goal to improve the quality of life for everyone in our community by delivering faster, more reliable internet, clearer, more feature-laden phone service, quality TV channels, all with the level of customer service you'd expect from people who are your neighbors. Eagle Communications. Our community connected.
Welcome back to the second half of our forum program here on Eagle Community Television. If you have any questions, ideas, thoughts for great shows, send them to me, gary.shorman@eaglecom.net. You can also cruise around on Facebook. You'll find us there under ECTV Forum. Our guest today is Jessica Seib, and Jessica is an RN out at Hayes Med. She's also involved in training out at the OB and the NICU unit for babies and taking care of things out there and doing a great job. We went around the 5 things that you need to do about the High Five program, but another initiative that's gone on in Hayes Med was early on this, and it's called the Hard Stop Policy. And I read that and it's like, wow, that's interesting when it applies to OB. But it has to do with early deliveries through C-section. I didn't even think about that, but the number was over 10 to 15% of babies are delivered early on purpose, and they're putting a stop to that.
That's correct.
Is that the hard stop?
Yeah, it is.
What was this theory there?
Well, we talked a little bit earlier about babies who are born a month earlier in that 34 to 36 range, and so some of those babies do okay, and some of them don't do so great. So by having pregnant moms wait until they're 39 weeks to deliver their babies gives us a better, healthier baby at delivery time. So, in the end, there's less in healthcare costs and things like that too. And of course, parents get healthier babies. So
you'd mentioned earlier that there's a lot of Medicaid is involved in a lot of different things right now, and that's one of the stats that they came up with, that the healthier babies, if you can go full term of 39 weeks, that's a much better thing.
It is. There is some information out there from March of Dimes that shows infants' brain growth from 35 weeks compared to 39 weeks. And a lot of brain growth occurs in those last 5 weeks of the pregnancy. So moms who are wanting to deliver just because they're uncomfortable and it's time to, they feel like it's time to have their baby, they're missing out on some important brain growth that doesn't happen after the baby gets delivered. So. And
I know sometimes there's no choice. The mom starts delivering no matter what.
Right.
You can't do that, but those that would choose to do that early, and then that was kind of an interesting thought process. I hadn't even thought about that, but
yeah.
One thing to have Hayes Med out on the lead on making sure that that doesn't happen, and some of that by requirement. But the other thing is it does help hospitals and with the cost of OB and taking care of all that.
Correct. Yeah, and sometimes a mother's body just isn't ready to be induced, and so C-section rates were increasing because of some of those choices of people wanting to deliver early, and if their body's not ready to be having a baby, then they would end up being a C-section. So having that hard stop there is going to help a lot with those numbers and hopefully bring those C-section rates down too.
Let's talk about some fun things, because you can go on the Hayes Med site, and I thought click on the baby thing, but there's an official way. Tell me how you go on the website and actually go through, because there's some neat things you do, including some of the top names that are out there. We were talking about that before the program. But where do you go on the Hayes Med site?
Well, we've always had the baby book that you're referring to that has some baby pictures and baby names. But there's also under the departments, there's the OB department, and it lists like our doctors and their names, and has pictures associated if someone's new to the community and doesn't know, who's out there or who to choose for a doctor. It has a link to the pediatrician's website as well. It talks about our unit and has some pictures and the services that we offer, and has some websites that are safe to use and good resources too.
When should a parent do that? You're going to be delivering a baby, obviously, or thinking about it. My guess is the sooner you start on that process, the better off versus waiting till the last trimester to say, where am I going to go?
Yeah, I would say early on, as soon as possible, start learning and start finding information, because things, as pregnancy goes along, women, they get tired sometimes. Sometimes they may deliver earlier than they were thinking that they would, and we've had that occur sometimes with patients that they didn't get to go to their classes because they had their baby early. So the earlier they can plan, the best that they can educate themselves with information and from reliable websites, the better.
Well, here's a good example right here. Jessica Seib, who's part of the HaysMed unit for OB. They do a great job out there. Go to the website, check it out, hit the button on OB, right? And it takes you right there. You can also find out the top 5 baby names, which is kind of interesting. See if your name's on that list. Thanks for watching Forum here on Eagle Community Television. It's brought to you by HaysMed and by Eagle Communication. Our community connected.
Youthful body, tight tummy, smooth facial lines. Greystone Cosmetic and Reconstructive Surgery is here to help you achieve your goals and give yourself the new look you've always wanted. Greystone offers sophisticated surgical and non-surgical cosmetic procedures. With services now available locally, there's no need to wait any longer. Contact Greystone Cosmetic and Reconstructive Surgery at Hayes Medical Center today or online at greystonecosmetic.haysmed.com.